Hi, my name is Walter Epic, and I am very happy to be presenting during Healthcare Simulation Week on a topic that's near and dear to my heart called Let's Talk About It. Hi, my name is Walter Epic, and I am very happy to be presenting during Healthcare about a topic that's near and dear to my heart called Effective Debriefing for Healthcare Simulation. Before I get started, I'd like to share some disclosures that I have. I get some salary support from the Center for Medical Simulation in Boston to teach on simulation educator courses. And I also get per diem honoraria to teach on simulation educator courses from a simulation collaborative in Germany. And I've gotten honoraria from the New York City Health and Hospitals. For those of you who are watching, I have created this short URL as well as this QR code for you to get the handout that will summarize all the slides that I'm going to be using today. So I'll pause for a moment. Perhaps you could just take a photo of this to access the slides and the handout later. So the goals of this talk, which is probably going to take the next 30 minutes or so, are multiple. I'm hoping you'll be better able to create a safe but challenging learning environment, debrief effectively in an honest yet non-threatening manner, both how to debrief and what to debrief. So we'll be focusing on both process and content of debriefings. And finally, to identify strategies to ensure that learners get meaningful performance feedback. Now, I will say in the time that we have, it's very, very brief. So one of the other implicit goals is for me to share resources with you so that you can look at some articles, listen to some podcasts, and digest all of this after the session is over. All of the links to podcasts will be shared at the end and are embedded within the handout, so they'll be easy to access. So what is our roadmap? First question we're going to ask ourselves is why debrief? The next question will explore how to debrief, again, the process of debriefing. We're going to spend some time thinking about what to debrief, as in what content should comprise the debriefing. We're going to take a deeper dive into feedback and debriefing in terms of how to do it, what to say. And we're going to spend a little bit of time thinking about advocacy inquiry as a specific strategy to uncover where learners are coming from. And then, as I already mentioned, we'll share some additional resources that you can use to get further information and learn more about debriefing. So the first question is, why debrief? Why is it worth going through the effort of debriefing after a simulation? And I know that a lot of people say that's where the learning happens, which I would partially agree with. I think there's some learning that happens during the simulation too. But the bottom line is if we look at this paper by Tannenbaum and colleague, who asked the question, do team and individual debriefs enhance performance? The answer is unequivocally yes. Now, this study did not look at simulation-based debriefing, but did look at debriefings in work environments. And the answer is yes, debriefings help teams and individuals get better. So what I'm going to be doing for the rest of the talk, by and large, is locating the conversation within healthcare simulation, since it is Simulation Week. But also know that a lot of the principles we're discussing are immediately applicable to clinical event debriefing too, which I will touch on very, very briefly. Here's an example of a paper by Adam Chang and colleagues looking at the use of simulation and debriefing scripts to improve performance. And the bottom line is, if people debrief better, novice instructors who use a script lead to better performance in learners. And here's a systematic review that we did some years ago that also demonstrated the beneficial effects of debriefing in simulation. So there's a pretty robust evidence base that debriefing matters and that we should be debriefing. So when we think about what comprises healthcare simulation debriefing, there are a number of components The first of which is information, which I'm going to talk about a little bit later. And you can think about information about how people performed. And we could think often about the information being at times data or feedback. More about that in a little bit. During debriefings, learners should be reflecting, also reflecting for themselves and identifying areas of improvement, things that they should continue doing, and reflect critically. And that's one of our jobs as educators, is to help them do that. And the other piece that's a particular challenge is integrating honesty into debriefings. And when I say honesty, I mean honesty on the part of the learners, that they can honestly reflect on things that perhaps did not go as well, but also honesty on the part of the educators. Importantly, to honestly share their perspectives on what happened, because there's a lot of great value there in learners hearing what the educators think about how they did. And increasingly in the literature, we're realizing that what also is important and contributes to effective debriefings in simulation and in clinical environments is the relationships and the learning culture that enable those conversations to happen. And when I think of relationships, I think about knowing your learners, establishing rapport with them, but also the culture that influences how feedback is generally accepted and processed. Before I continue, I'm going to offer a brief disclaimer, which is just to say that I am not here because I am perfect at debriefing. I have good days and bad days like everyone else, and there are times when there are things that come out of my mouth that I think, gee, I wish I hadn't said it just in that way. The reason why I'm here is because I spend a lot more time thinking about debriefing than most people who are probably listening right now. And I would say, with that basis, know that I can't answer every question, nor do I have the right strategy in my own debriefing practice for every situation. So as I already mentioned, we're going to focus on two specific aspects of debriefing. The first of which is how to debrief, which is very often what debriefing courses focus on, and that's the process. The other piece that's equally important is the content of the debriefing, or as I like to say, what to debrief. And it is the marriage of these two aspects that is critically important. So it is this sweet spot in between process and content, how to debrief and what to debrief, that we're striving to achieve when we are doing debriefing in whatever context we're in. What I'd like to do now is take some time looking first at the process of debriefing and then the content of debriefing. So first, process. And in particular, I'd like to talk about establishing a supportive learning environment. So here are two images on the screen. One is a desert and one is a verdant forest. And the desert is meant to signify an environment that is barren, that doesn't quite support learning as much as the right side of the image does. The forest is has moisture, there's a river there, there's a good foundation for learning there. And I always like to ask what contributes to a supportive learning environment? And I think there are many things that contribute to a supportive learning environment, things that the educator can control and can actually implement. And what I'd like to do is I'd like to point listeners and viewers of this session to a lovely paper by Jenny Rudolph and colleagues in Simulation Healthcare about establishing a safe container for learning in simulation, really focusing on the pre-simulation briefing. This is a really important part of simulation-based education, and I would say in my own educational philosophy, one of the most fundamental aspects. Jenny and her colleagues cover aspects related to introductions, creating a safe environment related to care and comfort, clarifying expectations so learners know what's coming up, explaining how feedback and debriefing will happen, knowing how the day is going to unfold or the session will unfold. Again, this is one of those resources I'm pointing you toward to take a closer look. At its core, what we're striving for when we're thinking about establishing a safe container is creating a sense of psychological safety within our learners and within the collective group, because certainly we're all learners in a collaborative sense. And psychological safety is a belief that one will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And in particular, it's an environment in which interpersonal risk-taking is possible. So this is what we're striving for. Now, certainly psychological safety is not wrapping people up in cotton. It's not making them feel so comfortable that they, making them feel too comfortable. It's about making someone feel comfortable to take risks and put them at the edge of their expertise, because we know that's where you learn. You learn when you're at the edge of what you're able to do with the support of the educational environment and educators. As one additional reference, Amy Edmondson, who's a professor at the Harvard Business School, talks about teaming and how individuals come together to form a group that engages in certain behaviors that allow them to learn together. And there's a chapter in her book about psychological safety, which I strongly recommend. As part of this safe container, also in my mind, is a certain learner-centeredness that is related to the educational environment, but also to the debriefings themselves. And here's a paper that Adam Chang and several of us, including Jenny Rudolph and others from the Center for Medical Simulation and other places, and myself wrote, highlighting essentially this paradigm shift from being a simulation educator who is a sage on the stage to being someone who is perhaps a guide on the side, who is supporting learning and creating a space for learning to happen. Again, this is another one of those resources I would encourage you to look at. But learner-centeredness is more of a philosophy than a strategy. It's a way you approach it. And I think it's integrally linked to this notion of creating a safe container for educational experiences. So if we take a closer look again at debriefing process, or how to debrief, what I'd like to do now is unpack a little bit about debriefing structure and function. And to do that, I'd like to use the Pearls debriefing framework. So I had the great pleasure of writing this paper with Adam Chang several years ago, where we talk about a blended approach to healthcare simulation debriefing. And one of the things we recognized in our own educational practice and in conversation with colleagues is that people are using different strategies in different situations rather than using a one-size-fits-all. And we spent some time thinking about it and decided to articulate a blended approach to healthcare simulation. So how can you take various strategies and use them all within even a single debriefing, depending on who your learners are, how much time you have available, what is the specific performance domain, is it a teamwork-oriented session, is it a procedural skill, these sort of things. So within the Pearls framework, there are the characteristic phases of a debriefing, which have their particular purpose. These are not necessarily the new aspects of the Pearls framework. I'm going to go through them briefly now. The reactions phase is there to allow learners to vent, to share what's on their mind, to initially process some of their emotions before they can move on to the cognitive aspects of the debriefing work. As Laura Rock from Boston would like to say, emotion before cognition. So a really important part of the educational experience here is the reactions phase. Then we have the description phase, which we use to clarify what the medical issues are, what the learner's perspective of the main issues are. Then, of course, the main part of the debriefing is the analysis phase, where you look at things that were working, things that should continue the next time, things that didn't work so well, and what would they do differently next time. This takes up the lion's share of the debriefing. Then, of course, the summary phase, where learners distill main takeaways for their future practice. So these phases are ones you will likely recognize from the literature. What I'd like to do now, though, is focus specifically on the analysis phase. This is, in my mind, the novel contribution of the Pearls debriefing framework. And in our literature review, we identified 3 very broad categories of approaches educators use in the analysis phase. The first of which is learner self-assessment. Second is focused facilitation. And then, of course, providing information in the form of feedback and teaching. When we think of learner self-assessment, what comes to mind is essentially the educator asking or inviting the learners to reflect on what was working for them and what would they change next time. Common approaches in this, along this line, are the plus delta technique, or other very simple approaches that can be yet very powerful because they're very learner centered. And it also gives the educator an opportunity to get a sense of how learners process the event. It can be very nice, for example, at the beginning of a debriefing to use a learner self-assessment approach before moving on to a more focused facilitation technique that allows you to dig deeper into certain aspects. Some focused facilitation techniques may very simply be to name a topic that you'd like to discuss. So I'd like to focus on communication, specifically the communication during high-risk situations in the case, such as when you're intubating. So that notion of previewing, as the colleagues in the Center for Medical Simulation would say, this notion of framing the conversation so people know what it's about. And then, of course, using additional strategies such as advocacy inquiry to dig deeper on specific topics. More about that in a little bit. And then last but not least, providing information. And information can be in the form of directive feedback and teaching. More about that in a bit too. So when we think more about the process of debriefing, not only is it knowing how to do it, but it's also what you say and how you say it. And what I'd like to do here is introduce a light version of the Pearls debriefing script. So before the simulation, or after if it's an in situ simulation, I would generally recommend that we are doing this before, that we would get people to introduce themselves so we know everyone's name, maybe a little bit of their background, and then to review the ground rules. For example, review the basic assumption, which here I have listed as we all want to save kids, which is something I have from Betsy Hunt from Hopkins, but it's essentially an affirmation that everyone is trying their best. At the Center for Medical Simulation, where I have the pleasure of working, we also say, we believe everyone participating in training is intelligent, capable, does their best, and wants to improve. And the reason this is important is because no one is perfect. And in the debriefing, we're going to shine a particular light, not only on things that were working, but things that did not go so well, with learning as our goal. Another thing that I often say is that everyone has something to contribute irrespective of your experience level. And I also emphasize that the notion of confidentiality, which is what happens here stays here, that we don't discuss individuals' performance outside of the simulation. Another ground rule here I should add is this notion of emphasizing that people act differently in simulation than they do in real life. And so we ask them to do their best. We do our best to make a realistic environment, but we know people act differently, but we can still talk about the problems that they faced in the care of their patient. Then I think it's important to set the stage, to let people know how long the debriefing will likely last, maybe be 15 or 20 minutes, and then to invite people to share what they were thinking at various points in time during the case. I think this notion of setting the stage and unpacking process is particularly important if people are not experienced with debriefing and don't know how it will unfold. The reactions phase is in the center. You to ask how people are feeling right now that the case is over, or ask them what the first thing off the top of their head is, would be one way of doing that. And then getting responses from as many people as possible. And I would say that there are a number of approaches. Michaela Colby from Switzerland very specifically likes to invite everyone to share an initial reaction, and would frame that along the lines of, gee, I would love to know how you're feeling right now, and I would like to hear from everyone. So I'm just going to start with you, name of person, and I'm going to go around the room just to get everyone a chance to share. And then, of course, the description, which is getting everyone on the same page about what the main issues were. And I think here I'd like to invite someone to summarize what the case was about from their perspective to make sure that everyone's on the same page. And I should comment here that this invitation to summarize is not a test. It's really to hear where the learners are coming from about the case. And it could be that someone provides a nice summary, and as the educator, the debriefer, you would say, that sounds like a fair summary. Does anyone have anything else to add on that? And then important here is that before you move on, that the educator clearly affirms that, yes, this was a case of a child in sepsis who needed aggressive fluid resuscitation and hemodynamic support in order to become stabilized again. Whatever it is, just it's important that everyone knows what the case was about before we continue. A very basic form of analysis would be a learner self-assessment, and it would be simply to ask, from your perspective, what worked well and why, what would you change next time and why. And then, of course, as your skills improve, you can consider probing using the focus facilitation methods or providing relevant information and feedback. But I think this notion of what worked well and why, and what would you change next time and why, is a good beginning part of the debriefing. And this really is the sharp technique of debriefing that Maria Ahmad and colleagues from the Imperial College in London published in this way. But a nice learner self-assessment approach that you could use even if you're not experienced at debriefing. I generally like to ask if there are any other burning issues before winding down, just to make sure there's nothing new or there are no surprises before moving on. And then ending with a summary question that invites learners to share what they're taking away from the experience that will help them in their own clinical practice. So getting them to commit to something they learned in their own words, ideally. And of course, once you've heard from learners, you can, an educator might add additional points, but this is really a learner-driven phase of the debriefing. So if we think about debriefing content, what can you debrief about? This is a really important matter because you would approach the different performance domains in a slightly bit of a different way. And if you're interested in this a little bit more, have a look at the Pearls paper I pointed out earlier. There's more detail in there about that. So I'm going to be introducing a series of slides from a colleague from Zurich, Switzerland, Jan Schmutz, who's one of my collaborators. And if we think about three broad areas of debriefing content, the first of which is the task work. And task work is the work that the medical team needs to do. It's the care they're providing the patient, whether it's doing procedures or intubating, giving medications, making decisions about what could be going on. That's task work. And then, of course, there is the teamwork, which is how the team works together to achieve the task work. And I think this distinction is incredibly important because it allows us to think about how we organize lines of questioning for the debriefing, knowing that task work and teamwork are often integrally related. Then, of course, there are system and logistic issues, system issues, which is a big point of in situ simulation, of course. So why is this important? The performance domain impacts how we debrief. As I already mentioned, task work and teamwork. And I like to highlight here that task work and teamwork are really interrelated entities. So as you're thinking about what to debrief, use objective performance data whenever possible. And a clear example of this would be resuscitation education or time to achieve key interventions. Again, in resuscitation education, how long is the pause in compressions before the shock, the pre-shock pause, these sort of things. And importantly, explore how teamwork achieves or prevents the attainment of task work. I think this is a really important notion. It's not a matter of saying, let's talk about the teamwork here, then we'll talk about the task work. there really is a marriage of these two things, and you can link them together if you explore how teamwork helped or hindered getting things done. And last but not least, and this is something I'm going to unpack a little bit more, is explore how teams reflect together to achieve their goals. And I think this notion of reflecting together is incredibly important and comprises a significant portion of my debriefings. And I'm going to spend some time talking about this notion of team reflection or team reflexivity, which is a notion that I've been exploring in writing with my colleague Jan Schmutz. Again, these are his slides. So what is team reflexivity? Team reflexivity is a team's ability to reflect on group objectives, strategies, goals, processes, and outcomes of past and current performance and make changes accordingly. So it's reflecting together so that you can adapt to what's going on. And this is particularly important in highly dynamic situations which are perhaps vague, where the next step in action is not as clear. So here's a paper that we published and came out this spring, and it focuses on this notion of team reflexivity from the lens of learning and the lens of patient care. And Jan and I included a conceptual framework here that I'd like to touch on briefly for you. And the reason why I'm doing this is because each aspect of reflection is something that can be that can be integrated into the debriefing. So here's a patient who's getting some patient care, let's say in the emergency department. The first form of team reflexivity is before the patient care event. Let's say an ambulance calls in and says, we're 10 minutes away with an elderly patient who's having a lot of trouble breathing. In the first instance, the team can reflect together before the patient arrives. We call this pre-action team reflexivity. And of course, the other forms of team reflexivity are during the action or in action, and then post-action, which is a debriefing. So a pre-action team reflexivity would be doing a briefing or a huddle before the patient arrives, which is very much focused on the future and optimizing upcoming patient care needs and thinking about what are our goals, what are the tasks we need to accomplish, how we will work together, what are the resources we need. And the main outcome here is being prepared and creating a shared mental model, getting everyone on the same page about what needs to happen when the patient arrives. And by the way, we often ignore this particular piece in debriefings and in simulations. And I think we need to integrate this piece further because this is a fundamental aspect of effective patient care. Although we know in certain environments, events happen and there's no opportunity to do a huddle in advance. In-action team reflexivity can happen concurrently with care, depending on what's going on, or can be can occur during an explicit team timeout, if you will. It's focused on the moment, the present moment, and to optimize patient care. It can again focus on goals. What are we achieving right now? You know, our main goal is to ensure adequate oxygenation in this patient. These are the tasks we need to do in order to accomplish that. This is how we need to work together. These are the resources that we need. Here again, this is about creating a shared mental model within the team about what is going on and what needs to happen in order to adapt to changing situations. So, and I as an educationalist would argue that this is important for learning from workplace activities. So if I could give you an example of in-action team reflexivity, if I'm in the emergency department and we're intubating a little child who is hypoxic, and after intubation, the saturations remain low, let's say 80%. And we've gone through the typical things we would check to work through hypoxia post-intubation. One of the things we could do to initiate some in-action team reflexivity would be to say, hey, let's recap for a moment. This is what we have. This is our priority. I feel like I'm missing something. I need your help. So this notion of team reflexivity is unleashing the abilities of the team to address the issues that are going on that require teams to adapt to ensure safe patient care. Now, this is important because we can discuss during debriefings how teams engage in this process of recapping, summarizing, reevaluating, and planning for the adaptations that are required. And of course, post-action team reflexivity is nothing more than a debriefing, which in simulation is guided. It's focused on the past in order to look forward and optimize future patient care. And important here, I think this is an important driver of learning. So this is our model. If you're interested, have a look at the paper. But again, for me, I spend a lot of time in my debriefings thinking about this notion of how teams reflect together both before and during events in order to ensure good patient care. Again, some examples of in-action team reflexivity, so during patient care. Listen, can we just summarize what's going on here? Let's come together and just make sure we're on the same page. Or, okay, listen, we've done A, B, and C. Is there anything else we need to do to get ready for this difficult airway? Any ideas? So at this point, the patient's not responding to our treatments and the oxygen saturations remain borderline. I feel like we're missing something. Any ideas here? And these sort of behaviors are things that we can then debrief in the debriefing and encourage people to move forward in subsequent scenarios. So again, content of the debriefing can focus on the task work, teamwork, system, and logistics in summary. And thank you, Jan, for allowing me to borrow these slides. For those people who are interested, last year we published a paper that seeks to translate some of these lessons from healthcare simulation to clinical event debriefings and coaching conversations. And in this paper, Adam, myself, and colleagues Paul Mullen and Marissa Brett Fliegler came up with a debriefing script that's more aligned to clinical event debriefings, but is very much that very much embeds the PEARLS framework in it. So you could think of it as a paper about the PEARLS framework for debriefing, and I would encourage you to check that out. What I'd like to do for the final portion of this session is focus on feedback and debriefing. And as I already highlighted before, that's an important part of the analysis phase. It's an educational strategy that learners and educators engage in collaboratively. And this is about providing information in the form of directive feedback and teaching. So what are some of the key issues for feedback? And I'm taking this now from a paper by Haiti and Timperley in 2007. But the first notion that's important is this notion of feed up, or where am I going? And this relates very much to the goals of the whole activity. Feedback, how am I going? What progress am I making towards that goal? And this is what we mostly conceive of when we think of feedback. And last but not least, but the notion of feed forward, where to next? What do I need to do to make better progress next time? And these are related to simulation because for feed up, include the goals in the pre-brief. Tell people what the goals are for the activities. This doesn't mean you need to share every learning objective, but at a high level, our goals are, for example, systematic assessment of the patient and at the same time, addressing threats to life within a team context. And these are the things that we're going to be focusing on. Systematic assessment, A, B, C, D, E, and identifying threats to life as they come up. And we're going to also discuss how you work together to achieve these goals. And of course, feedback, which involves integrating key performance data and opportunities for feedback. And then also the feed forward is about coaching learners on how to practice with a focus on improvement. This feed forward is something I think that we fall short on in many instances. So it's helping learners identify what they need to do to get better. So there are some feedback and debriefing dimensions that we published 2 years ago, and I'd like to unpack them for you a little bit. And this first notion of data as being information about how learners did on, let's say, chest compression depth or chest compression rate. And we could view this as feedback. So their data and feedback are integrally related. And of course, there are various sources of data. There's expert feedback, which everyone is aware of, but there's also feedback from peers, from simulator or CPR devices, and of course, task feedback, and in clinical practice from patients, of course. When and how often does this feedback occur? Could be synchronous, sort of as it's happening, or immediately right after it happens, or delayed somewhere down the road, which is typically what happens after the scenario ends, for example. Now, if we think about the debriefing, which is encompassing this feedback and the data, we often think of post-event debriefing as after the simulation scenario or the event. And increasingly, we can integrate feedback and debriefing during simulations, sort of as a pause and discuss / rewind approach, as in rapid cycle deliberate practice. And this is some work that Betsy Hunt from Johns Hopkins has done and published on. And what we're going to do here is we're focusing really very much on the post-event debriefing. So what happens after the event is over. So when we think of sources of data that we could integrate into the debriefings, it's verbal feedback from peers and from educators, for resuscitation education from CPR devices, including defibrillator-generated data, standalone feedback devices, or information from mannequins. There's data from the simulators, as I mentioned, about defibrillation, medication administration times, about ventilation, and of course, performance checklists. And I mentioned video here. That can be a source of data, although unfortunately the studies are not super supportive about integrating video. And I'm hoping that there are studies down the pipe that untangle this controversy about the extent to which video is actually helpful in debriefings. Just a word about focused facilitation, and in particular about a debriefing strategy or conversational strategy that is widely used. And I'd like to think about how we could dig deeper using advocacy inquiry, which is, of course, a conversational strategy that Jenny Rudolph and colleagues from Boston translated from the organizational management literature and made it accessible for us in healthcare. And focused facilitation is part of the analysis phase in the debriefing. And AI is one of those strategies we could use. And fundamental to using advocacy inquiry is the notion that thoughts and actions are linked. What people are thinking drives what they do. And what they actually do is their actual performance, which may or may not align with what the desired performance is. So I think about often patients who come in with allergic reactions, let's say someone with a peanut allergy, and someone's coming in with wheezing, with a rash, perhaps with some vomiting, and the desired performance would be to, monitor the patient, give the patient some intramuscular adrenaline or intramuscular epinephrine, and then maybe put an IV in and give additional medications. And if the team does not give the epinephrine, that would be a performance gap that I could then explore and understand the learner's frame of mind. I'm thinking epinephrine was indicated in this case. The learners did not give epinephrine, and I'm curious what was going through their mind. And what's fundamentally important here is this notion that learners are trying to do the right thing. They are intentionally rational. They have an intention of doing the right thing. And yet it doesn't always work out that way. So much like we would want the same courtesy for us, if someone's questioning what we're doing, we would like to figure out where they're coming from to learn their thought process. And if you'd like to learn more about this approach, I would point you to Jenny Rudolph's and colleagues' excellent paper on debriefing with good judgment, which is a classic in the healthcare simulation literature. One of the goals with debriefing is to be honest, but in a way that's non-threatening. So it's not about being blunt and direct or harsh and hurtful, but about being honest in a way that people can hear what you're saying in a way that's honest but non-threatening. And one approach to this would be to tell learners what you'd like to talk about. Tell them the topic up front. I'd like to spend some time talking about basic life support and how you delivered basic life support in this case, because it's so fundamentally important. And specifically, I'd like to talk about the compressions. Tell them what you saw or heard in the form of data. So if I'm talking about chest compressions, I might say, I was noticing chest compressions that were going at a rate of 80 times per minute. Or I was looking at the simulator and it was saying that the chest compression rate was 80 per minute. Then tell them what you think about what you saw or heard from your point of view. I think that's too slow. My take on the guidelines is 100 to 120 times a minute. And then ask them what they think, an inquiry. So this is the main 4 steps of an effective advocacy inquiry question. This preview statement, share an observation in the form of data, share your point of view, and ask them what they think. And in the Pearls debriefing script, we added some additional language that added some meat to the previewing, to the observation about the performance, to expressing your point of view, and to inquiring about the learner perspective. And I would say that when you access the handout, you can have a closer look at this, but this is part of the debriefing script that is from the Pearls debriefing paper and is one that I use when I'm doing my simulation educator courses. And it helps people formulate advocacy inquiry statements and touch on all the 4 steps. And by the way, I should add, one of the fundamental things here is this notion of using I statements or speaking from the first person perspective. This is what I saw. This is what I think about it. What do you think about it? And the real value here is that once you learn the frame of mind, where the learners are coming from, you can provide individualized teaching, build on it more, or probe further. So you can really tailor your debriefing to what the learners say, either to probe deeper or do some teaching. And I think this is one of the main beautiful aspects of this approach. So we've spent quite a bit of time talking about the process and content of debriefing, and we've talked about how you might put it together. And I would encourage you to have a look at the debriefing scripts that I mentioned, one in the Pearls debriefing paper, the ones I've included here in the handout that I'll share with you in a moment, and the clinical event debriefing paper. So have a look and find a way to marry process and content. So what we've talked about healthcare simulation debriefing and how information, reflection, and honesty are important parts of this, and that relationships and learning culture are fundamentally important too. What I'd like to do is I'd like to point you in the direction of additional resources. These 2 blogs are incredibly helpful. Simulcast is run by Victoria Brazel and Jesse Spur from Australia, with a journal club that's run by Ben Simon, a fellow pediatric emergency doctor. And Debrief to Learn is a blog website, both of which, by the way, are non-commercial, that is edited by Adam Cheng, Vince Grant, Brent Homa, and myself. And there's blog postings on each of these websites with podcasts that will help you get your hands around this important part of healthcare simulation education. So I would point you to, if you're interested, to Simulcast. And there's a podcast that Vic Brazel, Jesse Spur, and I did about debriefing. There's the link that you'll be able to just click on in the PDF. And then on debrieftolearn.org, there's a podcast with Adam Cheng and Jenny Rudolph about creating a safe container that I highly recommend. There's a podcast with Michaela Kolbe from Switzerland and myself about blended debriefing approaches. And last but not least, there's a podcast with Jan Schmutz and me about team reflexivity, if you'd like to learn more. So what I'd like to do is thank you so much for your attention. We had some technical problems, so this is being broadcast via YouTube, and I'm not sure how I would entertain any questions from the audience. I'll just leave it at that and leave this slide up for you to use a QR code reader to get a link to the handout, or use the short URL right there. And I would just end and thank you so much. not seeing this. Okay. Oh, good, okay, because I just, it was no way from knowing if it was working or not working. I figured you would have, okay. How many people, watch since then? I'm out of the,